Have you ever wondered what happens when men enter a world built for women? This study uncovers the voices, struggles, and growth of male student nurses in maternity care. This is Man in Maternity Space, live experiences of male nursing students in delivery rooms. Good day, ladies and gentlemen. Allow us to introduce ourselves. We are the Group 3A from BSN 3D.
This study aimed to explore the lived experiences of male nursing students in delivery rooms.
Now, for the instrument of our study. Semi structured interviews were conducted to gather in depth insights into the experiences of male nursing students in delivery rooms. A survey questionnaire was utilized, which consists of two parts. Part 1 is the demographic data, including the age, academic level, and delivery room exposure of our participants. Part 2 is the clinical experiences, which includes the challenges, impact, and perceptions of our participants.
For the data gathering procedure, we followed a structured process. First, we used purposive sampling to identify qualified participants. We then obtained signed consent forms. Once confirmed, participants were scheduled for interviews and appropriate rooms were reserved. We conducted and recorded the interviews, then transcribed, summarized, and organized individual responses. Throughout the entire process, we strictly maintained the privacy and confidentiality of all participants.
For the research design, this study employed a phenomenological research method with a qualitative approach.
And now for the results and discussion. This section presents the thematic findings derived from the lived experiences of male nursing students during their clinical exposure in delivery rooms. Through qualitative analysis of interview data, five major themes emerge, highlighting the emotional, professional, and cultural challenges the participants encountered, and as well as their strategies for adaptation and growth.
Presenting Theme 1, Engaging in Communication and Building Patient Interaction. Male nursing students navigate gender-sensitive spaces by using empathetic communication to build trust and foster meaningful interaction with laboring mothers. For this theme, two sub-themes emerge. Building trust through communication. Male nursing students earn the trust of laboring mothers through empathetic dialogue, verbal reassurance, and by relating to patients as if they were family, helping to ease gender-based discomfort and promote compassionate patient care. Sub-Team 2, Understanding Communication Barriers. Male nursing students encounter communication barriers shaped by self-doubt, limited confidence, and cultural biases, underscoring the need for emotionally intelligent, cultural sensitive training to enhance trust, care quality, and clinical confidence. Theme 2, Facing Gender-Based Challenges and Role Perception. Male nursing students in maternity setting encounter stereotypes and self-doubt, navigating emotional and societal barriers that challenge their professional identity and confidence. Sub-themes are: number 1, encountering stereotypes and patient hesitation. Male nursing students often face patient discomfort and societal barriers that question their presence in the delivery room, limiting their learning opportunities and sense of belonging. Sub-Team 2, struggling with self-doubt and hesitations in first DR experience. Initial exposure to maternity care evokes emotional uncertainty and self-consciousness among male students, driven by gender norms and fear of misinterpretation.
For Theme 3, Developing Clinical Competence and Learning Through Experience, where male nursing students experienced growth as they develop clinical skills, confidence, and identity through hands-on learning in a gendered space. Three subteams emerged. First, cultivating empathy and respect through experience, where students coped with gender bias by maintaining professionalism and building respectful patient relationships. Second, gaining confidence through practice, where confidence grew through repeated clinical tasks, mentorship, and positive reinforcement. Lastly, realizing the gap between theory and practice, where students realized classroom knowledge alone was not enough and valued real-life application for deeper learning. For Team 4, experiencing emotional and psychological reactions to first exposure, where initial exposure to childbirth triggered strong and emotional responses and shaped personal and professional growth. Two subthemes emerged. First, experiencing culture shock and anxiety, where students felt overwhelmed and unprepared in a female centered setting. Second, sensing awe and fulfillment, where witnessing birth led to deep respect, empathy, and appreciation for maternal care.
Now, for Theme 5, Seeking Acceptance and Inclusion in the Maternity Setting. Male students navigated shifting attitudes and found belonging through support and mutual respect. And two subthemes emerge. First is changing attitudes towards male nurses, where students noticed increasing acceptance and respect from patients and staff in maternity care. Second, receiving support from clinical staff and group mates. Encouragement from instructors, midwives, and peers created a more inclusive and empowering environment.
For the conclusion, this study revealed that despite facing gender based challenges and initial discomfort in the maternity setting, male nursing students experienced significant personal and professional growth, eventually transforming obstacles into opportunities for compassionate care and affirming their place in a traditionally female dominated field.
For our recommendations to the nursing administrators, this study encourages gender-inclusive policies to support male nursing students in maternity care. To the clinical instructors, this study offers insights into the emotional and professional challenges male nursing students face. To the pregnant patients, this study supports culturally sensitive practices that build trust and improve birthing experiences. To the nursing students, this study helps male nursing students understand and overcome biases in maternity settings. To the future researchers, this study provides a foundation for studying gender dynamics in nursing education.